Hello everyone, my name is Akanksha Sharma and on behalf of my entire team, I will be presenting our abstract entitled Female Genital Schistosomiasis Detection using AI-enabled transfer learning. The FGS disease affects 56 million women and girls in sub-Saharan Africa and is a neglected tropical disease globally. Infection with the S. hematobium worm, which is found in low and middle income countries, occurs through contact with contaminated fresh water. Women and girls in endemic regions often encounter this water during daily course, leading to female genital schistosomiasis disease. The accurate FGS diagnosis is challenging due to limited trained providers, subjective assessments, and limited colposcopy equipments. The clinical screening involves the use of colposcopy and visual assessment of the cervix. There are four main lesions identified for the presence of FGS, named as greeny sandy patch, yellow sandy patch, abnormal blood vessel, and rubbery papules. The presence of any one of these lesions on the cervix confirms the presence of FGS. The figure on the right hand side shows the schematic of the lesions with real life examples. The literature has limited number of FGS studies which have used statistical methods to validate the presence of cervical lesions. They have employed colorimetric analysis, characterization of blood vessels, and grid-based approaches to identify the lesions. On the contrary, the cervical cancer diagnosis using the similar colposcopy images has benefited from well-established visual assessment using the acetic acid, which generates prominent aceto-white lesions which are easy to detect using the conventional image processing and machine learning methods. The objective of this study is to evaluate the performance of a machine learning-based AI model for identifying the presence of FGS from cervical photographs from a cohort of 368 women in Zambia. The methodology involves three stages: image acquisition, pre-processing, and training and testing. In the image acquisition, we acquire the colposcopy images of the cervix. In stage B, that is the pre-processing, we first crop the image to get rid of the unnecessary regions such as speculum or the vaginal walls and tissues. Later, we move to removal of the specular reflections, which are a common artifact in the cervix images. In the training and testing, we use a pre-trained ML model known as DynoV2 to extract the features and thereby perform the conventional training and testing. The detailed description for detecting the SR components is shown in figure 2. So from the cervix images, first we obtain a feature image from the SGNL components, which are obtained from the HSV, RGB, and the CIE color last faces respectively. Thereafter, filtering and normalization and thresholding is performed on the feature image, followed by some morphological operations to enlarge the regions corresponding to the reflections. The finally identified regions of the reflections are filled with a pre-trained diffusion model. The results show a best performance was obtained as AUC equals to 0.72 with a 95% confidence interval of 0.61 to 0.84, specificity of 0.56, and sensitivity of 0.89. Figure 3 on the right shows the integrated gradient maps and the respective colposcopy image of correctly classified FGS subject in A, correctly classified healthy subject in B, misclassified FGS subject in C, and misclassified healthy subject in D. As we can see in figure A, the yellow patch is visible in the colposcopy image of the FGS subject. The corresponding pixels in the IG map show high activation in the area of lesion region, indicating that the FGS attributes are being captured by the model. However, for misclassified FGS subjects, figure 3C as well as figure 3D, the incorrect predictions could be driven by a number of factors, including the lesions are visually not prominent, low illumination and field of view of cervix not being enlarged enough and centered enough to capture the relevant features, and the SR corrected regions with high network activation values are incorrectly interpreted as lesions. The results show the potential of the ML model to identify the presence of FGS from colposcopy images. In future, the directions will involve training the algorithm with larger discovery sets to further bolster the performance and perform independent prospective validation. Thank you.